on a USAID Cambodia Integrated Early Childhood Development activity. And I am a technical advisor to this project. So I know it well, but someone else originally did this presentation, so I'm stepping in for them because they are not here. Really quickly, this is, as I said, an integrated project. So WASH is just one component, but the project's true mission is to focus on nurturing care and helping caregivers make sure that their children up to the first 1,000 days grow up healthy. And we also do a lot of work with people with disabilities to get them access to appropriate healthcare facilities. And then there is a WASH initiative, which is supposed to increase access to safely managed water and sanitation. We are working in 2 different provinces in Cambodia. And in our provinces, there has been a lot of work on market-based sanitation that was done by a number of other organizations historically. And so we're coming into an area where there's somewhat of a saturation of accessible sanitation. There are a lot of businesses that have been trained and offer solutions for what I'm going to call a typical area. And so that means the people who don't have access have these unique different problems. And so what we found is a number of people live in areas where there's frequent flooding. They have high groundwater tables. There is hard ground, so digging is difficult. They are water scarce. And then there's also floating communities. And because our goal is to increase access to sanitation to these last mile populations, and these are the people we have to focus on, our question was, how do we get them solutions that are viable for these different challenges? Along with that, we also had to do some behavior change, and we tried to target it to these particular areas. Again, I mentioned that Cambodia benefits from probably, I think, 2 decades of successful market-based sanitation, as well as behavior change interventions. So we're really trying to leverage what existed to target a different population that was either overlooked or did not respond to the previous interventions. And so we looked at what existed and tried to change some of the images or tweak some of the language to really focus on these areas that have unique geographic challenges. And so the solutions that we found were really, we highlighted 6 of them. 5 of them, we have actually developed manuals in collaboration with the Royal Government of Cambodia. And we are going to be making those publicly available for other people. But we looked at what was being implemented by different groups in Cambodia, and we found these 6 different ones would solve some of the problems, but we really focused on the 5, everything except for the Sato, because it's not available locally in Cambodia. If you are interested in getting these manuals, they will be available at some point this year, and I'm happy to share them. But again, they have different ways of taking waste and having multiple container systems. So in the case of flooding, you can close a valve and make sure that there is no effluent that is dispersed into the environment. And then they have these leach fields to make sure that there is water that is then released and doesn't contaminate the water tables that are often near these latrines. So one of the things that we found when we were trying to engage this community and also promote these different technologies is that there's actually no even standard definition on what a challenging environment is in Cambodia. And so Cambodia does have a really great national database of who has access to sanitation, but they don't have any notes on unique challenges in different communities. So even identifying these communities was something that was a struggle at the beginning. They're also some of the hardest to reach. And so we really wanted to focus on those local solutions to make sure that there were people who could provide those solutions to these different populations. And to address that, we did training for a number of artisans on these different technologies. And we also made those manuals that will be publicly available in English, in Khmer, which is the local language, so they could use these manuals to implement these different solutions. We are also offering smart subsidies at the moment. I know that is not necessarily a sustainable intervention forever, but our goal is to at least increase access for the first time and get them on that sanitation ladder. And hopefully, as these technologies become more prevalent, they will become more affordable, and then people will be able to replace or repair as needed. There's also a lack of any fecal sludge management in the rural areas. So that's why the solutions you saw mostly have a containment area that should have some sort of treatment before anything would be released into the environment and ensure that there's no contamination of the water sources. So these recommendations come from a number of different things that we have experimented with or found from our 2 years of implementing these activities, we have found that you really do need to do behavior change. I think that people think just because there is low rates of open defecation, they may skip the behavior change and go straight to market-based solutions. But that isn't true because a lot of these communities need something that's targeted and different. I think I briefly mentioned that one of the areas we're working in is a floating community. And we have a solution that could potentially work. And even with high rates of subsidies, people are really unwilling to try it just because it's something that they're unfamiliar with. And if without this behavior change component, we would have gotten 0 people. We have found 18 out of a community of, I think, 220 people are willing to be a pilot test. And so we are working with them to get them a solution that was devised, especially for floating communities. You also definitely have to think of the seasonality of when you should be doing these behavior change communications or activities, or really selling these sanitation facilities, because a lot of times there is seasonal variation in when people are going to be able to purchase this or actually even build it. And so again, for our floating communities, you can't go for half the year, and you definitely can't build it for half the year. So planning when you would do the intervention along with the seasonal factors was very important. And I think the last point I really was going to make is that there is, at least in Cambodia, and it's related to the norms, we have found that people think that sharing a latrine is more shameful than open defecating. And given that that is a local norm, you have to really start thinking through how to have a conversation in these communities that have heard previous interventions and have not responded to them. And so what we've been trying to do, which is a little different, is with these new technologies that are, again, developed by local organizations and promoted by local organizations, we're working with the local sanitation businesses, with people in each of the communities to have first conversations and then try and demonstrate these different solutions and share them widely, which we hope to be able to lead to sustained adoption of these different technologies. I think that was the end of my presentation. So that's briefly what we're doing in Cambodia.
Thank you. Thank you very much, Mark. Thank you to all of you for being here. I will present on sanitation in challenging environments for PSI. So my name is Joel Ochieng. I am a WASH advisor for Population Services International based in Nairobi. And yes, I'll start by first introducing a brief introduction about PSI. Population Services International since 1970 has been working in public health, malaria, HIV, and yes, health system strengthening in general, and WASH. And specifically in WASH, our work is really market-based sanitation approaches. We are working with human-centered design to develop products that are better suited for communities that are attractive and affordable. We have to work with, we have to develop supply chains in doing this. We have to help sanitation entrepreneurs to market their products. We help them to test and to build their capacity. And also we work with governments and local authorities to have policies that support the sanitation market. However, overall, we really intend to make to pass the point that sanitation markets have potential and are viable and are profitable to entrepreneurs. We work with many colleagues and friends in the room in these countries for working together with RTI in Western Kenya, for the Western Kenya Sanitation Project, working together with the Tetra Tech in West Africa, Benin and Cote d'Ivoire, under the USAID Money Wash project. I'm also supporting Mozambique, and our colleagues from Ethiopia also. I'd like to talk about a little component of our work that relates to difficult environment sanitation challenges. We have a wide range of activities in this context, which are market-based. Specifically, these communities that are in urban areas and dense urban settlements around, for example, this picture is taken in Cotonou in Benin, where the compounds, residential compounds are really rented compounds, and people are gathered together with no access to centralized sewage systems and very low coverage of improved sanitation, toilets, and so on. At the same time, in these areas, we have very high water tables. So these areas flood frequently, and a lot of garbage that is made in the streets. We are working with many solutions that we have developed, and we have also adopted from others in the sanitation sector. This is one of them. We are promoting digesters. They are called biodigesters locally. So they are a compact solution for households in residential compounds. And they are particularly attractive because they are quite compact, easy to construct. So they take up very little space in the residential compound. And at the same time, they are quite affordable. So we have worked in cycles to try to optimize the treatment in terms of the effluent water quality. And yes, they're quite compact, they're quite affordable, and they're quite attractive for these residential households. They also make the residential compound to be more attractive to renters, of course. So landlords like them because they help them attract tenants. We have made adaptations for these units in high water table areas as well. And this is an example where we raise them a little above the ground so that they are not affected by floods. Part of our work really involves developing the market and the business environment around these approaches. So we have worked with the sanitation entrepreneurs to develop posters and banners such as these ones. The idea is to have this product to be attractive and very desirable for households and for house owners. And so it has to be cheap, it has to be easy to construct, it has to be profitable to the person who is constructing it. And this is the cycle that we are trying to do. We support sales by sanitation entrepreneurs, which is important because these are people who know the market quite well and talk to their consumers, get feedback, and this feeds into the development of the products. We have supported these entrepreneurs to launch a brand in Benin for Bay language. It's WC Mimin, which means clean. It's a kind of a sub-brand that they use to market the products. We are working with the private sector, that is the sanitation entrepreneurs, and the local authorities. So this banner, for example, is developed together with the local authorities in Cotonou. So there is that collaboration between the private sector and the government. Always in such situations, government resources are quite limited. So it is better to sort of pull together resources from the local, from private sector and the government together to have solutions such as these ones. Over these projects and many of our other projects around the world, we have had many challenges and we have learned some lessons. We continue learning as well. The first lesson that I'd like to highlight from this is just that the importance of local solutions to local problems. The people on the ground know a lot about their situation, and we can build from those what they know already to make better sanitation products and services. Also, I think many of you recall, having worked with market-based sanitation for some time, that previous approaches such as sanitation marketing, for example, did not necessarily work with existing enterprises. We tried to create new youth-led enterprises which were not really well placed to be viable businesses. We have really learned to work with really existing enterprises who know the market well, and we've begun to build on that. It is also important to continue iterating the products, continue developing them and making them better based on learnings in the field and from outside, as well as to work together, the private sector and the government, to put the resources together. Because when both sides work, there can be better chances of success. We were talking on Monday and yesterday about smart subsidies, really to reach the poorest part of the population who cannot afford a digester, for example. So very well targeted subsidies for these sectors of the population are very important. Thank you.
Hello, everyone. I'm Troy Benavides with Lixil. I'm the leader of government relations and policy and strategic partnerships. Lixil is a global plumbing and building manufacturing company. We're based out of Tokyo, but we have operations around the world. And I was happy to see in the last two presentations our Sato pan highlighted. That's probably how many of you know us. But here in the US, you're probably more familiar with American Standard. So I wanted to showcase today a project we're doing here in the US under our American Standard brand. And this is a program in Lowndes County, Alabama. And yeah, so it's really in the Black Belt of Alabama. And that region highlighted there. It goes east to west across the state. There's 17 counties in the Black Belt, and really the Black Belt there's really a dark soil that really poses, I think, the most significant challenge for us from an environmental perspective. This soil does not allow traditional systems to percolate or to process waste like in a traditional drain field. So there's 10,000 homes in the Black Belt suffering from this problem. We didn't expect to see this in the US. It was something we stumbled across 5 or 6 years ago. So we really wanted to focus, the work we've been doing around the world with Sato. We wanted to take that experience, those capabilities, and bring them right here to our own backyard and see if there was something we could do. So we began this project, like I said, about 5 or 6 years ago. But the scale of the problem is pretty big. Very similar. It's a rural community where you would expect to see these problems, right? A rural community, low income, decentralized system, and requires more of an on-site system or solution. There are numerous challenges. I mean, there's the lack of a failing infrastructure, being remote. We can't create a centralized system. There's a lot of space between these two. If you think of Lowndes County traditionally or historically, it's between Montgomery and Selma. So there's a lot of racial issues that have come through. The march between Selma to Montgomery went right through Lowndes County. The environmental challenge is this soil. It will not allow any of the traditional systems to work. So much of that, and what that means is there's quite a bit of pooling of waste. So the individuals in this community are now doing something what we call straight piping, which is they have a toilet in their home, but they're running a PVC pipe straight into their backyard, and we're seeing pools of waste in the backyard. And depending on where you live in Lowndes, you're downhill, the waste kind of goes away. If you don't have that luxury, you can maybe push it, whatever the flow is, you can maybe push it 5-10 feet away from your home, but you have kids playing in the backyard, and you have that exposure to those contaminants right there in your own backyard. So that's the problem we're dealing with. There's also been a significant amount of trust lost over within this community. I guess for 50 years, government has come in, tried to solve the problem, offered certain solutions. Those may or may not have worked. We've had health departments come in and penalize people because it's the homeowner's responsibility to manage their on-site system. And with low income and really no alternatives, many of these communities are fearful. So a lot of mistrust around this and something to overcome. The lack of skilled labor is also significant. Like I said, between Selma and Montgomery, that's about 40 miles. That's how far a plumber has to travel to be able to do any work if we get a system installed here. And this problem's been around because it needs an innovative solution, and there are significant barriers to bringing innovation into the market. There's obviously the cost of it, but the regulatory environment doesn't allow for it, right? It just requires much more around an innovative system, and this is just a challenge when we look at it. The funding restrictions and the complexity, we're learning it's not just a sanitation problem, right? It's a very complex problem that is built on socioeconomic issues. There's in-home issues, there's housing issues, there's quite a few other issues to address that isn't just the sanitation problem, and the funding provided doesn't allow for us to be able to address some of those other issues. So we're having challenges addressing the sanitation issue without addressing some of the others. So really the soil, as I mentioned, is this dark, fertile soil, shrink soil clay, low percolation rates, poor drainage. In some of these images, you can see that pulling. It's also very rainy in this community. So when the rain comes and you've got this system that's already, solid or waste sitting above ground, then add the rain to this, we're seeing some of it back up into straight pipes. So we're seeing waste going back up into people's homes, popping up into their toilets and their bathtubs. The behavioral changes that people are experiencing with this is significant. They're not putting toilet paper down their drain. They're listening for that gurgling in the system to know that it might be backing up, and then they're not able to use their toilet. So there's a lot of adjustments people are making, and they're teaching more generations about it as well. One woman we talked to has to teach her grandchildren, when you hear that bubbling, you can't use the toilet, and then they've got to find other ways to deal with this. So when we looked at a project design and implementation, we were really trying to figure out how can we design a project that will address those issues. So we achieved some initial funding in partnership with the Alabama Department of Health, along with the University of South Alabama, through the U.S. Department of Agriculture, to start a program here. We introduced water efficiency into the equation. So, if water is sitting above ground, it seems the water is the problem, or the effluent is the problem. And if we could use less and put less water into the system, then we can maybe make some progress. At least we can reduce it by 20–30% and sort of shrink that pool. And when we get to a system, hopefully we'll see that the system can process less water, and then maybe elongate the ability of that system, or the longevity of that system. It took us a while. Like I said, we've been doing this for 5 years now. We had a pandemic in the middle of that, so that delayed us a little bit, but we were finally able to find a solution on innovation that we brought from Japan, a Fuji Clean system that we think will help address this. It still requires a drain field, so we'll still be dealing with the effluent in the ground. But by treating some of that in the system, we're able to put less into the drain field, make the drain field smaller, and at least put cleaner effluent into the system too, so you don't have as much contaminants in folks' backyard. The workforce issue is still a challenge, so we're reaching out to young people to incorporate them into the process. And I'll talk a little bit more about that in a minute. And then we really needed a community leader to overcome this issue of trust in the community. So here's the system we come up with. It was the Fuji Clean system. Like I said, it's a smaller tank. It still captures solid waste, but it allows us to put smaller drain fields and cleaner effluent into the system, so we don't have those contaminants, even though they may be floating to the top during the rainy season, or it might not work as efficiently during the rainy season. It's still not there still aren't as many contaminants as if it was just a straight pipe and the pooling in the backyard. The workforce issue, like I said, we wanted to develop some skilled labor and some capability in the community if we're going to be putting in these systems and improving the water efficiency and plumbing inside people's homes. we need people to do some basic plumbing, fixing leaks, checking on the system, make sure it's working. So we're reaching out to high school students to do home assessments, and we did this in partnership with the I Wish Foundation and IOTMO. And ideally, we're going to hopefully pique some interest in young people to go into the plumbing profession, or at least be able to provide basic plumbing in the community where they live. Looking forward, this is and some of the lessons learned. These challenging environments at this time require really adaptive and innovative systems. There's not a one size fits all, or that would have been done before. Community-led organization was critical, as I mentioned, overcoming the trust issue. Partnerships are key. We've been doing this for 5 years. The way we started in this organization is not where we are now, and we're doing something very different. So having committed partners who can work with you to help solve those problems is key. And this is not new to many of you, but the flexible funding. These are really complex problems. We've been able to tap into infrastructure funding here in the US, but it's very specific funding for very specific outcomes. And these are complex problems that require, like I said, in-home changes, economic changes, workforce changes, and much of the funding doesn't necessarily allow for that. So our goal is to complete the 100-home pilot and then be able to replicate that and scale that to the 10,000 homes that still need help. Oops. Sorry. That's it.
Good afternoon. My name is Getachew Balana. I'm Deputy Chief of Party for Climate Resilient Water Sanitation and Hygiene Activity, which is funded through USAID. Since we started this project in Ethiopia, it is 1 year, and we have one more 4 year more to go. So just to briefly highlight what Climate Resilient WASH is doing, it is actually expanding access to improved water and sanitation in lowland context of Ethiopia, like Afar, Somali, Oromia, and also Somali, Afar regions. The major objectives are four. That is, one is professionalizing and expanding quality climate resilient water services for pastoral communities in lowland areas. Actually, the plan of this activity is just to reach 620,000 people through safe water access. The second one is increasing sustainable access to and use of sanitation, including menstrual health and hygiene activities, products and services to these pastoralist communities as well. And the third one is improve gender power dynamics. And the last one, but not the least, is strengthening the enabling environment to make success of other three objectives in pastoralist communities. Just to look at into context, this pastoralist context in Ethiopia is arid, semi-arid, and also dry, where also drought is repeatedly affecting these regions. That's why this is a challenging environment actually to intervene WASH services. The other one is this community are residing actually across lowland areas, mostly pastoralist community. They move from one place to another place to look for water and pasture for livestock. And also this is potentially decreasing the value of stationary sanitation in this infrastructure in this context. The other one is they are also, they are not purely pastoralists, they are agro-pastoralists as well. They constitute the Ethiopian 61% of the total land and the population of 12 to 15%. So they have also low access to water, that is 40 to 61% range for water, and 7 to 21% for sanitation services. So as compared to agrarian setup in highland areas of Ethiopia, this is very low coverage. So even as per the GMP in this area, and also in 2022 update, 18% of the population are defecating in the open field. So this is actually more important to target and also reduce open defecation practices in these areas. Just Climate Resilient Wash has done some assessments, which is categorized the constraints that we found from the assessment in terms of contextual, in terms of psychosocial, technological, and enabling environment. In terms of contextual, actually these pastoralist communities, lifestyle, and low population densities, actually, as compared to agrarian setup, is very, which is actually hindering the motivation for latrine building in this pastoralist community. And also women are more likely to adopt latrine, but men are decision makers in the pastoralist communities. Actually, in the pastoralist communities, women are more responsible even to more than latrine to construct houses in Somali region, for example, in Afar region. So they have a huge burden in this area. The other one is the soil condition is also a challenge, as we have seen other cases from Cambodia and from the other areas as well. And in pastoralist communities, as they are mobile, they are more prioritizing food over sanitation. If you talk, if there is no food access, then we cannot talk about sanitation. So they prioritize. This is actually the discussion from the assessment we found on the context analysis. Psychosocial aspect, as I heard from the other colleagues, the people in pastoralist area dislike sharing latrines. So they want their own latrine. As I have tried to mention earlier, they give priority for food as well as water and pasture for their livestock. So that is the challenge we have in terms of accessing to sanitation. The other one, the pastoralist communities, actually, due to bad smells coming from the traditional type of latrines, they favor to use open defecation as they want bush areas or open areas for privacy and comfort as to their context actually and perception. In terms of technological, if the private sector, small and micro enterprises avail products, probably the affordability issue is a question for them. And also priority issue is also another factor which affects us to consume these services. The other one, in the enabling environment, actually there are policies and strategies in Ethiopia. But when you look at policies and strategies, these policies are not more tailored to pastoralist context or these lowland areas. So they privilege mostly for agrarian setup. So it needs to be modified. Actually, CRWASH has done context analysis and prepared sanitation and hygiene implementation strategy tailored to the pastoralist communities. In terms of capacity monitoring and follow-up by community and order level of staff, it is very limited as we from the assessment. In terms of context leadership also lacks and do not give more emphasis to sanitation. They give more for other priorities. So these are the situation assessment results and context constraints. Just ongoing activities, this CRWASH is using water supply access as an entry point for sanitation and hygiene activities, because the priority of these pastoralist communities is water for their livestock and also human. So that is our entry point we are using. The other one is designing pastoralist tailored sanitation and hygiene approach, what I have mentioned earlier actually. Illustrations, preparation of illustrations, as you can see from the picture bottom. This is actually more tailored to Oromia Borana zone area, cultural clothing and everything. If you take the photos or pictures from the other areas and try to illustrate, they will reject because that is not their own community. So they will advise you to take to that community rather than accepting and implementing. Okay. Yeah, that is the basic issue. The other ongoing is actually we are training and integrating with health extension workers. They are government salaried workers at each kabale or below the sub-district actually. There are 2 per health facility are assigned, trained and assigned by the government. So we are using those health extension workers. And also the very important thing that is bringing change in this activity is using religious and clan leaders to facilitate this modified CLTSH application in the pastoralist communities. The other very important thing that we are doing is we are facilitating women-led micro and small enterprises. So previously it was owned by men. Now we are initiating women-led private sector engagement in these areas. The other one, building the capacity and also collecting different lessons from one region and sharing to the other region is also very important component. Just lessons and results. Actually, before in doing sanitation activities, we are using health outcomes. But people in the pastoralist communities are not more actually sensitive for health outcomes, but they are, because of that, we have included freedom, love, and respect as one of the behavior motivators in these pastoralist communities. The other one is we are encouraging a community to construct their own toilets by locally available materials. Then they will improve through course using private sector links from the fabrics. Yeah, the other one is use of stone masonry, for example, as you can see, and also the lining of the pit is the stone masonry, so that they can prevent bit poor soils. They are using this. Actually, we have already installed like 1900 latrines in this using this approach, and also we have a plan to go for 120 villages or communities to make open defecation free in the coming 4 years. Thank you.
Hello, everybody. My name is Tate Rogers. I'm the founder and principal at Triangle Environmental. Here's a little bit of background on us in case we're quite small, so you might not have heard of us. I started the company back in 2016, but everyone in our group has been working in the wash space for over a decade now. So we primarily started out supporting a lot of groups with designing, implementing new sanitation technologies. So we supported several Gates Foundation funded technologies over the last decade. And although we're a team of 6, we've tested some prototypes in over 14 countries at this point. So we've gotten around pretty well. And so we're an R&D and consulting group. So primarily we did consulting, and then in 2019 we realized we had this kind of wealth of experience in the on-site wastewater treatment space, and that there was also a need in the US. So we started a product development arm of the company that's been focused on designing on-site wastewater treatment systems here in the US. And so since then, we've won now 4 SBIR awards, 3 with the EPA, 1 just recently with NSF, all focused on on-site wastewater treatment. But would love to talk to you. So we started off international and have come back. We continue to do our international wash work, but we've been focused a lot on the US market. And that's what I want to talk to you about today. So I'm from North Carolina, but we're finding out more and more about these sanitation issues that you think, especially being in the global wash world, are someone else's problem, and you realize they're in our backyard, literally. And so one area that doesn't get talked about a ton is just generally the southeastern coast of the United States. It's facing some of the worst sea level rise in the world. And today I want to specifically talk to you about our work in Eastern Virginia that's ongoing. But they have kind of in Eastern Virginia, especially, they're losing land. So sea level rise due to two things: sea level rise and land subsidence, because they're drawing down their aquifers. And it's affecting more and more people every year. And in Eastern Virginia, which I had no idea, they're losing land very quickly. And so just to kind of reiterate that point, so where we're working is in the middle peninsula of Eastern Virginia. So just in here. Yeah, thank you. That's right. Oh, perfect.
Right? Doesn't there?
Does it?
It should be the green one at the top.
The green stuff.
There we go. Oh, I think I got it. There we go. Perfect. So Middle Peninsula here. This area is facing, so if you look at this graph on the right, the red is the average sea level rise globally. And the blue is this area, I think it's right here. So it's facing double some of the worst sea level rise that we've seen in the globe here in Eastern Virginia, just a few hours away from here. And so what does that mean? Obviously that has some effects on the on-site sanitation system. So raise of hand, who was on a sewer growing up versus who had an on-site? So did you have an on-site system growing up? That tracks. So about 25% of the US has on-site sanitation, and about 33% of new builds have on-site sanitation. So this sea level rise is directly leading to a lot of sanitation issues that are becoming more and more in the news. So if you look here on the right, this Washington Post article that just came out recently, it's a good read. It's talking about, it focused a lot in Florida, but just in Miami-Dade County alone, which you think of as being a metropolis, where Miami is, they have 120,000 septic systems. 11,000 of them need replacing right now, and hundreds of thousands along the coast are going to need replacing. And they're failing because, as you can imagine, if you know septic systems, they rely on a septic tank to get out the solids, and then they have a drain field which uses the soil for the actual treatment. And opposite to like some of the perking problems that we're seeing in Alabama, here the water table is coming up, so typically you need about 3 feet to do any treatment, and that water table is coming up, so your drain field has less and less room to actually do that treatment. And then once you have a flooding event or it comes above the ground, it leads to backing up of septic systems. So there's hundreds of thousands of failing systems, and that's only going to get exacerbated as sea level rise continues to happen. And one interesting quote, so this is directly about the area that we're working in Eastern Virginia. They call it the septic repair capital of the East Coast because so many septic systems are failing. So specifically in the Middle Peninsula, so that's just that little area that I showed you, a very rural area, beautiful lowland area. They have 80,000 on-site sewage systems. All of them are going to be in trouble in the next decade to several decades. They're all going to be eventually less than 3 feet above sea level, meaning they're not going to get the proper treatment. 20,000 systems are predicted to fail. That number is probably low. A lot of people don't report their failing system because that means once your system's reported as failing, that means you need to fix it. That means you need to pay for a new system. And alternative systems currently, due to some of the challenges that they're facing in this area, can cost upwards of $70,000 for a single family home, obviously making it unsustainable or unaffordable for a lot of residences. And then in addition to that, as I mentioned, they're also drawing down their aquifer very quickly. So they're overusing the aquifer. That's leading to land subsidence. They have less and less potable water from the aquifer. So all these conditions are just kind of compounding on them. So a few years ago, they have these ongoing coastal resiliency adaptation challenges. So that's just how we found out about it. So Rise Resilience ran a challenge, but it was funded through Go Virginia, which is their growth and opportunity group through the state, which is actually focused on workforce development. So there's some common themes. They need to bring the private sector here to fix the water and wastewater problems, and they also need to train people to work there. Because I forget, something like of this rural area, 40% of the workforce leaves to go to like Richmond, which is the closest metropolis. So everyone leaves to go work. So workforce development is a huge problem as well. So they focus on a lot of coastal resiliency issues, this group, but they specifically put out a call looking for improvements in septic systems and on water supplies. And in septic systems, they had some really unique asks that we hadn't seen before. And so they want to be able to replace their failing septic systems. It needs to be affordable, obviously. They really wanted above ground systems because all these systems are failing. A lot of the alternatives are mounded systems, which are just going to be Band-Aid solutions because the water is going to continue to rise and they're very expensive. And actually, they've moved a lot of their thinking around mitigation versus adapting. Like they know some of this land is going to be gone. So it's like, how do we best use this land while we have it? And so that means you want systems that are transportable that you can take away with the property and you're not going to leave them in the ground and lose that value. So an above ground system and transportable infrastructure is not something that was really on our radar before this, and but it's really what they need. And the goal would be to either shrink or replace the need for a drain field. And on the water supply side, anything that they can do in terms of reuse, water reuse, where they're lowering the potable water demand on the well is going to be beneficial. So we we have a system that's focused on gray water treatment for on-site reuse, and then we've adapted it for this to also do septic tank effluent. So you can kind of set it up in two ways, either gray water coming from shower, sinks, laundry that you could treat and reuse. So we treat it to NSF 350 standards, which is non-potable reuse standards. So pretty much everything except drinking. But you could either reuse that for irrigation, and toilet flushing are kind of the lowest hanging fruit, and replace some of that potable water demand on the wells. And then also, we can also take the septic tank effluent and treat all of that to water reuse standards, some for reusing at the home or just to discharge to the local environment. So the goal is to get it clean enough that you can either put it to a dry ditch or back in the bay, but not need the drain field. So I'm not going to get too much into the technology. I'd love to talk to you about some of our technologies later on. This is the system that we're testing there. It's an on-site wastewater reuse system. So we haven't really named it yet because we aren't engineers and we're working with commercial partners. And I've learned that engineers should not name things. So, so this system treats septic tank effluent to water. So you can see the septic tank effluent on the left and the water quality coming out. This is the really cool site. So this platform is where we're testing the system. So this house is owned by the Public Access Authority. They're using this as a living lab for all these coastal resiliency projects. Obviously, our final system would not require this huge platform, but for us, it's a great pilot site. We're using an existing septic system, so we're allowed to fail, which we haven't, but we have a redundant system, so it's a great spot. We're actually trying to build this out for other groups to come innovate and test their wastewater technologies there as well. So we're treating all of the septic tank effluent from this house, which we've done up to 500 gallons a day, but it averages right around 100. One really important thing here is partnerships, and that's kind of come across from our work in developing areas. If you're going in a rural community, I'm from a very rural community, people have done things with the people they've done them with for a very long time. And you find that on-site treatment, especially septic, is a pretty traditional space. So you can't just come in here and start selling products, especially because so many people have their hands on it. To get a product all the way to someone's home, there's so many people have their hands on it. So what's really been great about this program is it's allowed us to work with local partners, including the Middle Peninsula Planning District Commission, and then pilot this in a way that people can come see it and we can showcase it. We also have Aramco Systems as our commercial partner. They've been around in the on-site wastewater space for a really long time. So they have that brand already built up. And then we're working with the implementers. So all these people over here are going to be in charge of regulating it. And like, these are the local installers. These are the local engineers that actually spec the system. So you have to have relationships with all of them to be successful. And I'll just mention just a few of the primary challenges, and these aren't just for Virginia, but just in general as we move forward in trying to get more and more on-site systems out in the space, especially in the US. As you scale, I mean, people always ask if our system scales up. Scaling up is easy. Scaling down to a household level at a price point that makes sense, where you can verify quality over time, is very difficult. And so a lot of the regulations now for on-site reuse have monitoring requirements that make it very cost prohibitive. And then, like I said, a lot of this stuff is like blowing the minds of the local regulators, and so that have done the same thing and been putting stamps on the same septic systems for 50 years. And so just navigating the city, county, state, and regulations has been a challenge. They have been very helpful, but they're, a lot of times their hands are tied with the way they've done things. And so that's been what we're doing in parallel, is working with the local regulators to try to think about new innovation. And then O&M. So one thing, I mean, people have talked about, when we talk to people at their home, the two things they care about their septic system is that they never have to think about it and that it's cheap. But now climate stress is bringing that to people's back door. So we're going to have to think about septic systems differently than we always have before. So setting up sustainable operation and maintenance systems around these more advanced systems is going to be super important as we move forward. And this is not just a problem in Virginia. These are going to be, all of these challenges are going to be important across the US. And that's it. Thanks.
Great. Thank you, everyone. That was a great, like, around the world tour of some of the sanitation challenges that we're seeing. And so we're going to ask all of our presenters to come up, and we have a panel prepared. Sorry. I know. And I don't know about everyone else, but I was definitely struck by some of the similarities, despite, having Cambodia, the US, a couple places in Africa represented. And I think for the first question for our panelists, oh, and I should say, we will open up to Q&A as well. So be thinking of your questions. We have a couple prepared for the panel that we'll go through first before opening to the audience. But yeah, so for the different situations that we've seen, there were, at least in my mind, two kind of similarities. We're looking at populations that are generally considered to be vulnerable. And then we're also looking at situations that are not going to improve. These are only going to get worse. These challenges we're talking about are only going to get worse due to climate change. And so the question is, knowing that we're dealing with vulnerable populations, knowing that this is a continuing challenge, what does financing look like for these solutions? And how are your projects working to sell these solutions to get governments and others to invest in them? So this is a question for everyone. So whoever would like to go first.
So for us, we are working in a low income area. There is some capability to purchase some systems. So we're trying to be competitive with a traditional septic system in terms of cost. The area where we're working in, luckily, the Middle Peninsula Planning District Commission is already tapping into the state revolving funds. And so some homeowners that have failing systems can apply and get their advanced systems approved. The problem with that is that money runs out like immediately every year, and there's way more demand than money. And so we're looking at ways and partnering with groups to try to like tap into more of those state revolving funds and other. But there is some capability to pay for systems, but obviously not $50,000 to $70,000 a home, which is what they're paying now.
Yeah.
Let's see this stuff.
Is it on? Absolutely. Okay. Just to build on that, just from an advocacy and a policy perspective, this last year we started looking at, and for some unknown reason, much of the grant level, particularly in the US, is capped at this random number of $25,000. I don't know if it's just a standard that is being set across USDA, EPA. It's just something kind of a go-to. So we're really looking at, these innovative systems are going to be more than that. So can we raise that level, right? Just to kind of advance the time. It's been 20 plus years or so that standard's been there. So we're also looking from an advocacy perspective of trying to just raise that limit so that when grants come out, like EPA grants or USDA grants, or even the infrastructure funding, at least there's some higher limits in there that would allow for innovation like Tate has.
Yeah, just to add that in our context, we really don't have a lot of government budgets and many other priorities. Local governments have many other priorities. So, we sort of favor working with the private sector, and we think that there's a huge potential for private sector investment in these technologies. So for us, really, it's one of the focus, getting the sanitation entrepreneurs to know that there's money in this. Is really a great attraction for them, because then they mobilize their funds, they invest in these products, and they compete among themselves also to reduce the prices of these products, and overall the sanitation market benefits.
Now it's on. So I just wanted to reflect on the question was vulnerable people and financing. And I think we should be very honest that all of these, I don't think none of us are working at scale. So we actually don't really know or have good data on what the actual price would be when you could implement this at scale. So I think or maybe you do, I don't know, I don't. But I think that for the moment, the financing really needs to be coming from public sources and donors with the understanding that there's a lot of questions that remain. And once we can figure out and really implement these things at scale, then you look at what is the true cost. And then there's probably still going to have to be some sort of subsidy work.
It working?
Yeah.
We figured it out.
Okay.
Thank you.
Turn it on.
It needs to be turned on. That will have to continuously provide some sort of subsidy because the solution for the floating communities in Cambodia, we're told right now is about, I think it's $450 upfront per household, and then it needs to be serviced, I think, every year. And then I don't know the exact replacement costs, but these are people that are, I think, truly some of the most vulnerable, and their livelihoods are being threatened by climate change. So they're not going to be able to pay that in the long term. So to be honest, it's going to have to be continued support or cross subsidies, or governments are going to have to figure it out. But for other areas, let's figure out what solutions would cost at scale.
I'm privileged to use this mic actually after on. So I just concur with my friend, colleague Joel, in Africa, like Ethiopia, the budget dedicated to wash sector is very limited from the government treasury. So most importantly, what the government and donors have is, there is one wash national program in Ethiopia, if you have heard, some of you might have it. So in that case, there is consolidated wash account where World Bank, FCDO, DFID, Africa Development Bank, different embassies, Netherlands Embassy, Finland Embassy, and others put together in a basket. So that fund will go through the Ministry of Finance. It will be distributed to districts or woredas and regions. So that budget, actually, the areas where RTI, CR Wash is working is not included under consolidated wash account. So what we do, the others are covered by consolidated wash account. What we do is we are linking with private sector. We are strengthening small micro enterprises in each district so that they can, we are linking also those with different microfinance institutions just to give some loans for households for sanitation purposes. So that's the means we are rolling out and also in the process. That is one thing. That is the major activity. The other one is there is also the government national sanitation subsidy protocol, smart subsidy. Actually, it's not subsidy. Before it was not implemented in Ethiopia, but now the government itself endorsed this subsidy, smart subsidy issue. So in our CR Wash pro-activity areas, we are going to exercise these smart subsidy practices. Thank you.
Anyone else? You can keep the mic down there because the first question is going to go to Getachew and Troy. So in both of your presentations, you talked about very remote communities where trust had been basically broken from being ignored for years and years and years. So what are you doing to work and rebuild? And I know, Troy, I think you started to talk about it and ran out of time a little bit. But what are you doing to rebuild trust in those communities that have been marginalized and ignored? And what are your lessons and recommendations when we're looking at these challenging environments?
Okay, thank you very much. Actually, this is a very important question that I would like to answer. The first thing is, in this challenging environment, the government, actually marginalized, these type of things are very sensitive in terms of politics in Ethiopia. So those areas, challenging areas like pastoral communities or lowlands, what we do for developing trust on us, on the government is, first, we use clan and religious leaders to enter to the community. We cannot just go and implement activities or interventions in the pastoral communities without the permission of the clan leaders. So clan leaders are very crucial to even for us, the community to trust. They are the ones who are bridging us. So that's very important thing. The second one is in these pastoralist communities, only going for sanitation may not work. We go using water as an entry point in these areas, so that when we go with water as an entry point, they are thinking that we are providing water for themselves and their livestock. Actually, the design for what the water infrastructure that CRWASH is implementing is inclusive of troughs for livestock. So they are very happy, and also they are more trust on us, so we can implement our interventions there. The other one is based on our assessments that I have tried to present earlier. Based on the assessments, we have seen context, we have seen psychosocial, we have seen technological, we have seen enabling environment. Based on those findings, we use actually for us to reach to the community based on the tailored approaches that we develop. So these are the ways that we are exercising.
Yeah, I touched on it. It's really the community-based organizations. When we started this program, it was with the State Department of Health, a local academic institution, and private sector. And what we learned is that the trust or mistrust and disinformation had been coming from years of experience with the Department of Health, where people were getting fined or potentially getting fined or fear of being fined for doing this. So we didn't have the right partners to go out into the community to start with, because those were the folks that had already, the community mistrusted already, right? So it wasn't good for us to go in with a government-led program, even though, that was the source of this funding. So we worked with the group there, created a local community-based organization, pulled local leaders, a group of women together who really wanted to see their community have this opportunity and see this change. And they led the effort in forming an community-based organization. And they often lead the town hall work and the outreach and the door knocking. And we know if any one of us shows up there without one of these community leaders, we don't get the phone calls returned. We so often don't get the doors answered. And there's still a little bit of misinformation that's circulating even after 5 years around that we should, this can't be trusted. It's another one of these programs where we've been promised something that isn't going to deliver. So these group of individuals who are doing the outreach for us are really critical to battle this disinformation that's out there.
Thank you. Joel, so you'll have the next question. It's like you guys knew what I was going to ask and sat here wondering. So you had a little bit of a different situation because you were talking about really dense urban and peri-urban contexts and some of the different technologies. And so how are you and PSI working to sensitize these technologies in that context? And what approaches have you been using to identify potential new technologies that are applicable to the urban context?
Okay, thank you. Mostly, we are working with local sanitation entrepreneurs. And the biggest advantage is that they are very well organized in Benin. I can give the example of Benin specifically. They are, business people, but they have seen the benefit of coming together and pooling their resources and importing components together and cooperating among themselves. So this has been a huge benefit because they can market themselves as a group. They can make their operations more efficient by coordinating demand and marketing efforts. They are using a lot of social media to get the message out to consumers about their services and their products. So the Sanitation Association has been a big help, and we have really tried to encourage that. The second part of the question.
The identifying new technologies, oh, it's sensitizing them, yeah.
Yeah. Also on identifying new technologies, they are naturally for business and for the sanitation sector, there is a kind of spread of knowledge and technology across borders. So Benin is just neighboring to Nigeria, and the sanitation market in Nigeria is much bigger. It's much more advanced. So people traveling across the border and moving around are exposed to technologies that are in the neighboring country and therefore learn from it. I just mentioned about the digesters that really were a product that was really in the region, really piloted in Ghana. And with time, people learned about it and felt like it can work here with some modifications. So technology flows, but needs to be supported in terms of investment and training and capacity building.
Thank you. And then, yeah, Tate and Mark, and we heard a lot about on-site, different on-site sanitation solutions, but yours two were probably just basically halfway across the world from one another. And so what do you think the role is or should be for that international or cross learning? You know, so I know Tate, you mentioned that you guys had experience with some global projects. And so how do you bring that into that learning into kind of this rural context in the United States? And then Mark, similarly in Cambodia, what are you doing to look at what else is being decided in the international context?
Yeah, it was interesting. I was just talking earlier how, you know, we started off as doing only global wash work, and now we're starting to do US work, and those are like separate conferences. And now I'm like seeing people at WEFTech last week that I saw at like the fecal sludge management conference in Vietnam. And so it's a pretty good indicator of me that there's more and more crossover here. And I think it's a very exciting time. I mean, we have the High Income Countries Day tomorrow, and I think there's a lot of learnings that both groups can share. And then, you know, there's marginalized communities and underserved communities all across the world, including in the US. And so I think we've taken a lot of the learnings. And there are certain things in the US that make it easier in terms of like access to some funds and supply chains that we know well, that we then would want to, once we have sustainable products here, translate abroad. The one thing that's like really, and we were just talking about earlier as well, is that's carried over is, especially in rural communities, the need for community engagement from the beginning. I mean, that hasn't changed at all in the US, and maybe even more so. And like I said, there's so many people that are going to have your hands on a product all the way through the development until it gets to the homeowner, and you can't bypass those. And so it just, you know, it's one of those things that takes time, and we've been trying to start that clock sooner rather than later in the communities that we're interested in, and trying to like build that engagement so that, you know, next year, hopefully when our products are ready, we've kind of laid that foundation. But that has stayed true anywhere that we've, in any context that we worked in, that you had to have that community engagement from the beginning to be successful.
Thank you. I think for me, I would focus a lot more on sharing across low-income countries, and I think that isn't being done enough. Even though I know Joel through work, I actually wasn't aware of what they were doing in West Africa when we were really looking at what we were trying to do in Cambodia. And even in Cambodia, what our first project that we did was an assessment of what was even being done in Cambodia. So people in Cambodia didn't even know. And we partnered with the government. And so the technologies that we have identified are now certified as government approved technologies. But that was because they didn't know what was happening within their own borders or within similar countries. Again, going back to the floating community solution, there's floating communities across a few countries. And if this works, it would be really great to get it to those communities as well. So I think these exchanges are really important. The last point I would say about actually going the flip, and I don't know if this is true, so it's a hypothesis or a question. From my observations, it seems the use of plastics really started more from a low-income country setting and has now been becoming more and more pervasive in high-income country places as an acceptable material, because historically, I think most things were cement or ceramic, and I think there's much more openness to have plastics as components. So it's an interesting the potential learning that came from low-income countries to the high-income countries.
Great. So we have about 10 minutes to take questions from the audience. So Jenny, do you think you could run the mic?
Sure.
Yeah. So you have a question?
Should we do it?
Yeah. Yeah, we're gonna take a couple questions at a time. We only have one mic, so please go ahead.
This question is specific for Alabama and Virginia. So on one hand, you have low perk soil, the other hand, you have high water table. What are the energy implications for your solutions? And with climate change ramping, problems to the energy sector and cutoffs and so on will also ramp up. And how does your solution adjust to all of that?
Thank you.
So in your respective geographic contexts, what is one thing that we should stop doing in order to improve access to safe sanitation services?
And we'll take one more question. I think the other one over here.
Thank you. Thank you. Mine is also for Alabama and Virginia. So between the different technologies you were promoting or piloting, have you done like any life cycle post analysis, and have you made like any comparison to use that maybe like as an advocacy or an awareness leveling, as an awareness tool to promote like the technologies you have for the household you are promoting? This mainly for those on-site sanitation you are promoting.
Yeah, we'll take your question too, and then we'll, yeah.
Great. Hi, everyone. I'm Maureen Fuller from Operation Blessing. Our headquarters is actually in Virginia Beach, and I live in Newport News. It's not the Middle Peninsula, but the one right below it that is experiencing the ×2 sea level rise. So great map, but my question also pertains to that area. Are you working at all with HRSD, Hampton Roads Sanitation District? And are there any initiatives that are focused more on the groundwater recharge efforts that they're doing?
Sorry.
I can start with that one. Yes, we're not working directly with HRSD, although my wife came from there, so I work a little bit with them, but they're more on the municipal level. So we've been focusing on household level on-site systems. So the program that you're talking about is called SWIFT, and so they're looking at like recharging the aquifer from plants with reclaimed water. Our goal is to get our effluent quality as high enough that we can do anything with it. That is actually one of the big questions for us, is where does the water go? And this is where it gets incredibly complicated. So, if it never leaves the home, your wastewater, it's building codes that govern it. If it goes outside underground, it's the Department of Health. If it's above ground or you're discharging above ground, it's the Department of Environmental Quality. Sometimes you have to use all three and they don't intersect nicely at all. And then you add like the Chesapeake Bay on top of that with its nitrogen issues. It gets very complicated. So that's a lot of the system has been running nicely for 6 months now. A lot of our work is just like figuring out, trying to navigate the regulatory pathway that would allow us to like get systems in short term and long term. But we haven't done like a full analysis of whether it would make sense to recharge like at the household. But our goal is to like be able to reuse water to like lessen the potable water demand on a house. So if you're using reuse water for watering your lawn or flushing your toilets, that's that much water you're not drawing from your well. But we are interested in that. And then the energy question, we're not a one size fits all solution by any means. We were just talking about there's some very similar problems in Hawaii that are going to require like a toolkit of options. There's some very interesting like natural systems that people are looking into that are very low energy. The hard part about that, the trade-off there is how do you guarantee quality over time? So we've kind of gone more, not to say that natural systems aren't engineered, but we've kind of gone more the engineering route where, or over-engineered system where we can guarantee the quality always. And so it's not low cost in terms of energy. I mean, but we're trying to be compared to a septic system and then be lower than a normal sewer bill. But we're always looking for ways to cut energy. But that is a question. So like, I mean, certain places where energy costs are really high, maybe our system doesn't make sense. So we're trying to see where we fit best. Yeah.
On the energy issue in Alabama, it's comparable to what a septic system or I guess a little bit, it's obviously more than straight piping, right, where there's no energy use. But what we've done by introducing the water efficiency component, where we're bringing down water use and water costs for the consumer. And we're advocating that they use then that savings to offset the operational maintenance of this advanced treatment system. So ideally, if we can reduce their water usage by 20–30%, they'll see that in the water bill and then be able to offset any additional costs to operate this advanced treatment unit.
Life cycle questions.
I forgot.
It was a question on the life cycle cost.
Have you done a life cycle plan?
I have not, so the Fuji Clean system is not ours, but it's been operational in Japan, and I can look into that for you. I just don't know.
And I don't think we answered the question, on sanitation.
What's something we should stop doing?
Stop doing. Yeah, I was gonna say, maybe get it you and then Joel can kick us off there.
Okay, thank you very much. Just to access sanitation services in pastoral communities, we can stop is providing latrine slabs for free. Because if we are providing latrines for free to the pastoral communities, they may not own and use it. So we need to stop that one. That's the main thing we need to stop.
Yeah, I think I would echo what Letachu has said also. I think we should, from my point of view, we should, yes, have smart subsidies, but we should not have dumb subsidies. I think I've seen this in a lot of programs, and they really distort sanitation markets. They really make it much more difficult for communities then to self-sustain after those programs are finished. And these are surprisingly, after a lot of research and practice and lessons learned, are still quite common in the areas in which we work. And yes, a lot of practitioners are here. And I think it is well known that smarter subsidies and smart subsidies do work. They require a lot of work and they need to be quite well targeted. But we need to pick up our level of implementation.
This was an interesting succession, because I think we do need dumb subsidies. I think what we need to do is stop thinking that the solutions for these areas are going to be taken up as solutions in normal areas, because they're so much more expensive that just the average person is not going to be able to afford these. Because in Cambodia, I can tell you that quote unquote normal latrine is about $75. And there's still times where that's a struggle to get people, but with smart subsidies, it becomes affordable. But when you're talking about a system that's $450, even an average person, that's not reasonable. And so don't think it's reasonable. And so it's my point for dumb subsidy.
This is a bit in a different direction, maybe controversial, but a lot of the work we've done in the past has been like, how do we design systems that require no behavior change from the homeowner? And I think that is going to need to change. I mean, climate stress is not allowing us to like have these large sewage systems where you don't ever have to think about your waste, or these large water systems. Some onus is going to come on the homeowner, whether they wanted to or not. And so I think rethinking the way we think about systems and the way homeowners interact with their water and wastewater systems is going to be super crucial. And I think we're going to move to more and more closed loop systems where you're treating all the wastewater at your home and reusing all the wastewater at your home and reusing fertilizer from your waste. I think we're going to have to go in that direction, and it's going to require a pretty large behavior change for everyone, including myself. And so I think that is going to be one shift that like I'd like to stop seeing where like are trying to design systems where that it doesn't change the homeowner's involvement at all.
Just you're an engineer.
Yeah, I know it's an engineer.
That's he's an engineer.
Say, but yeah, I mean, there's a lot of appliances that you
The
you
rest
have
of us
to
never
maintain.
thought that.
Yeah.
Troy, did you want to chime in on that one or?
No.
Okay, yeah, we have another question. Sorry, Jenny.
It's okay. Okay.
I think we can take two more, so if there's another question, we'll be able to.
Okay, thank you. My name is John Akudago and I work for Habitat for Humanity. Just 2 months ago, a researcher was talking about the greenhouse emissions coming from the water and wastewater sector. And they put it at 10% of the global emissions. I wanted to find out, with these new systems that you are designing, are you planning on capturing the greenhouse gases that may be coming out from the treatment systems? And yesterday, we also heard of the climate finance conditions. I mean, you would want to measure how much your system is contributing. So is this something that you are considering in both designs, both in the Alabama and the Philadelphia area? Thank you.
Any other questions?
One facet of the circular economy is rethinking ownership. Do we need to rethink financing on a perhaps a lease system? So that then if you don't own your home, the finance just gets spread over a longer period of time.
So, yeah, we'll be generous. We'll take your questions here. No, please.
I work in the high income country context also, but I think it seems to me the barriers that I observe are primarily in the realm of regulatory, like of what some of you guys were talking about, especially in the US context. High income or low income, are any of you aware of like a nice case study example of a government that's figured out how to, regulate well, like active regulator, a strong regulator, but it's also regulating on-site wastewater in a smart and effective way that's not super prohibitive? Or is it, is it maybe that's just anyone in the room, like a case study or a state or something where, you have a strong regulator that's also figured out how to do this in a not horrendous way. I'm curious.
All right, any takers?
Yeah. I'm
An eager taker.
I'm trying to do a quick answer to all three. Emissions from septic systems. Yeah, I mean, there's more and more work coming out of like how much actually emissions are coming from septic systems. We do have one technology that is in its early stages, but does capture the gas and then uses that biogas to treat the solids. There's also, but that kind of gets to a larger point though, I think in terms of like creative ways to subsidize these systems. Typically you think of carbon credits at like these large scale systems, but if you're able to show that you're keeping emissions out of the atmosphere with your system, and not only that, I think there's opportunity for nutrient capture as well. And nutrient credit market is pretty new, but I think that's a pretty interesting way to potentially like use these systems and to produce carbon and nutrient credits. Your question was on, leasing. So that is very interesting. You brought that up. So one thing that we've never thought about, because typically these systems go in the ground, the fact that ours is modular and above ground allows it to like move with the home if the area gets flooded. What that also means is we could rent the equipment. So the homeowner actually never owns it. They're paying a subscription fee. And actually there's a large wastewater company that does, commercial scale systems, and that's what they do. Even on like $1 million systems or millions of dollar systems, they're renting the equipment to the people. So I think there is some interesting opportunities there, even at the household scale. And then, San Francisco, I would say Polykeho in the US is like on the forefront of all this stuff. San Francisco now, any building above 250,000 square feet has to have on-site wastewater reuse. And then they're looking at how to like scale that down they're looking at regulations as well for home, at the home, but that gets hard in terms of like the monitoring requirements and not being cost prohibitive, but they are on the forefront of like, and I've talked to regulators there. They're like, oh, I never thought reuse would be a thing. And like, they've come completely around on it. So it's not kind of slow, but there are a few cities that are good examples.
Yeah, I would add, I think the product plus service is really kind of the way to go. So it's not putting this huge burden on the homeowner to buy these large scale systems, right? you think of a septic tank today, you've got to finance that yourself even, right? You can't wrap it into a mortgage, it can't be part of your home. So getting into the idea of it being a service, much like it is in a centralized system where it's paid a fee. If you can do this in clusters or in communities like Alabama, where there's maybe a small business that then can service this model. I think that's the way to go versus trying to put a burden of cost on the homeowner, renter, or someone to maintain the system and the responsibility to keep it up, because that's where we've seen the failure. If you can't afford to keep up a system like that, then you let it fail or you let it fill up. So I think there's a service model that needs to be added to this, not just the product solution to be purchased out. And on the greenhouse gas, we're looking at that, but I guess intuitively, it's got to be much less, to Tate's point, if we're treating closer to the home and we're creating a smaller system rather than our current system where we may be pumping and pushing waste, miles down the road in these large scale wastewater treatment facilities that use a lot more energy to process and treat and put water back into the system. So ideally at a smaller scale, we'll be treating closer to the source and ideally getting away from greenhouse gas effects.
Okay. Well, that was excellent time management from you guys because we were right at time. So thank you all so much for taking the time to join us today, both those in the room and online, and a big thank you to all of our presenters as well.
Can we get a picture?
Stay there. You guys want to sit so then that way the light is not on your face? And then
We need you here, sorry. You're a man of water. Yeah, I know. Well, you know what? It's weird about it. We didn't choose individuals. We chose organizations.